Some of the most common questions and concerns the Snohomish Health District has received lately are about schools and in-person learning, given the current level of COVID-19 activity in Snohomish County. At this moment, the data do not point to schools being the source of increased transmission in the community. In fact, the evidence to date suggests that keeping young children out of school would do little to help flatten the curve of this third wave. Many Snohomish County residents want much more in-person learning than is occurring, and many others want less. I have no data or words to offer that can close that gap. What I can tell you is that the countermeasures in place in our K-12 schools appear to be working. The Washington State Department of Health and the Office of the Superintendent of Public Instruction also continue to support the gradual phasing in-person learning for young students and children with special needs. Based on disease modeling, monitoring, and our own experiences with schools in Snohomish County, there is no disease control basis for the Health District to discourage schools from conducting careful and controlled in-person learning among young and high-need students. However, schools or school districts may choose not to offer in-person instruction at this time. Although the Department of Health's and the Health District's guidance sets a ceiling for in-person learning, it does not require that such be pursued. As educators and leaders of your school communities, you are receiving feedback from all corners, and we know you are working hard to make thoughtful, informed decisions. Plans for remote, hybrid, or in-person instruction will not necessarily be identical between school districts, and that's okay as long as the plans fall within the health and safety guidelines outlined by the Department of Health and the Office of the Superintendent of Public Instruction. The Health District will continue to provide information, guidance, and support throughout this pandemic. We share the same priority of preventing and controlling transmission of COVID-19 among students, staff, and families. Your partnership in this has been essential. Thank you.
My name is Carrie, and I'm the branch manager for the School and Child Care Response Team at Snohomish Health District. We have been working with our school partners since all the way back in July to assist and support them in the huge task they have of implementing the guidelines that are laid out in the Safe Start Plan designed to prevent the spread of virus in the school environment. They have done an amazing job, and it shows. Because of measures like social distancing, face covering requirements, daily health screenings, small group cohorting, and extra cleaning and sanitizing, we have seen very little spread happening in the school environment. When we do see cases, they're almost always single cases that are linked to events or exposures outside of the school.
When the Health District began working with schools on decision-making around in-person learning, the statewide guidance established a high transmission zone when 2-week case rates are greater than 75 per 100,000 in a community. At that time, we were down in the 20s or 30s, and we made plans to bring children back into school if they were high needs or in kindergarten through 3rd grade. Subsequent to that, we've undergone this third wave where case rates have climbed dramatically, taking us into that high transmission zone on the decision-making framework established by the state. That framework says that in the high transmission environment, such as Snohomish County now is, with over 300 cases per 100,000 residents per 2 weeks, that still high-need students, young learners, namely kindergarten through 3rd grade, and other students farthest from educational justice can still be phased in for in-person hybrid learning, provided the prevention measures that we are working with the schools on implementing are used. We've also found since then that conducting that activity, there haven't been any sustained episodes of transmission or widespread outbreaks in the school settings where this is occurring. Furthermore, the state continues to support our interpretation and application of this guidance in Snohomish County, as we are doing, continuing to allow for these highest priority students to get access to in-person learning.
Teachers and other school staff have gone above and beyond to address the challenges that we face. Your efforts do not go unnoticed, and we appreciate all that you are doing. We also hear your questions and concerns. Some teachers have expressed worry for the students that they are not able to see right now and have asked for more in-person instruction. We've also heard from teachers who would prefer to remain remote because they're worried for their students, colleagues, and own health. As a former high school teacher and librarian, I can understand where many of your concerns are coming from. With the current levels of community-wide transmission, there will be cases in schools, just like there will be in other workplaces. But school settings are different from other social gatherings. There are strict health guidelines in place. Students and staff must be screened, masked, and physically distanced to minimize risk. All of these precautions have been instrumental in the fact that there have been no instances of uncontrolled or widespread transmission of COVID-19 in K-12 schools in Snohomish County. The Washington State Department of Health has also been monitoring school outbreaks. The experts there report similar findings. Transmission in school settings have been rare and controlled. Much of that comes down to everybody's efforts in maintaining the health measures at your school. Everything is being done at the school environment to make it as safe as possible. If you have concerns, raise those with your leadership at the school or district level. If you feel like those are not being addressed, seek out input from OSPI or Labor and Industries. We also need everybody to make the environment outside the classroom as safe as possible. Coffee breaks, carpools, after-school get-togethers, weekend parties, these are the things that are driving up our cases in Snohomish County. If you're around somebody that you don't live with, please keep your mask on, plain and simple. I know that you're all ready for this COVID-19 business to be done, so you can get back in the classrooms with your students. You didn't go into education to be in front of a screen all day. We'll get back there. This isn't forever. This is just for now.
Although schools have not been shown to be a major driver behind the community-wide spread of COVID, it's important to remember that transmission in the broader community does impact schools. And we know that raises anxieties about whether or not to go back to school campuses if your school opens. I work for the Snohomish Health District, but I'm also a mom to 3 kids at 3 different schools here in Snohomish County. I have one with an IEP who relies on support services and is on campus 1 to 2 days a week. I have one who's making remote learning work even though it's not ideal. And I have one who's honestly flourishing in this distance learning environment. Just like my 3 kids, remote learning and in-person learning and every variation in between are not a one-size-fits-all. We need to make decisions about what is right for our family and our student and look to our schools as a key partner in navigating these unprecedented times. To keep in-person learning as safe as we can, it's crucial that we all do our part to reduce the spread of disease in our homes, workplaces, and social circles. This means staying home from school or work if you don't feel well, and quarantining for the full amount of time, even if you're identified as a close contact of someone who's had COVID. It means wearing your mask correctly, over your mouth and nose, in shared spaces, whether it's a grocery store, the park, a classroom, or with people at your home. It means that you don't gather for fun with friends or family outside of your household. Some individuals or families are uncomfortable with in-person learning, despite reassurances that prevention efforts are working in the school setting. And that discomfort may be more likely in households with older adults or others who are at a higher risk of severe illness from COVID. If you feel unsafe with in-person learning at this time, please talk with your school about the options available for you or your student. I know this is a challenging time for everyone, and the Health District will continue to provide updates for educators, students, and families. To find more information, visit our website at www.snohd.org/COVID. Thank you.